So, guys, like we will start now. Like I said, if anyone wants to post some queries or questions, feel free to put it in the chat. So you can type all your questions. So that like it doesn't affect the flow. We have more than expected. Usually we do with little lesser numbers. And since we have more people, we'll try to cover up all the points what we want to discuss. And at the end, we will answer all your queries. And if there is something that needs to be specifically addressed to a folie or slide, then we will just stop for a second and then discuss about that so that we can finish it on time. And that's also good. So having said that, so first of all, thank you all for being here, especially Andy. So Andreas Schmidt is an expert, a small introduction about him in the area of health insurance in general in Germany for last 30 plus years. And we do the sessions once in a while whenever he finds time. And I'm very thankful that he is able to do this for us once in a while also. So he is also he speaks good English, as you can see, some of you already, and he has an international family also. So he can understand what we are facing here as Indians, most of us in our daily lives as well. So please, Andy, could you say a few words? Then we can jump into the presentation.
Yeah, thank you, Aaron. There's nothing more to say. You said everything already. The most important thing is, as you said, my wife is also born in Asia. She's here for 22 years now, and it's getting more and more while we do this. So she's here for 22 years, and lots of her family is also in the United States. I also studied for 1 year in the United States. Also have friends and host family there. So yeah, our kids grew up bilingual or trilingual. So yeah, we've been traveling a lot. So I've been in this situation with my wife coming here, like lots of you guys, looking at all the changes and possibilities. So I can feel you actually, how the situation is.
Thank you, Andy. I think that was a nice introduction, and thank you once again for making time for us today. So I hope you can see my screen. So please tell me, everybody, when you can start to see the screen, so that I know that I'm on it. So can somebody confirm that it's visible for everybody?
Yes.
Okay, perfect. Thank you.
Yeah.
So we have the introduction from Andreas, so thank again. And today we will talk a little bit in detail. I'll just tell the agenda. So one is like, what is private health insurance? Who can take it? How it's calculated? So this difference between public and private, like does private cover everything what's in public, for example? And what is not covered? Can somebody shift to public? And what happens in a job loss? And so on and so forth. Like at the end, we have some surprise regarding the financial like benefits what one can enjoy with examples, and I have added something extra regarding what is happening right now in Germany in terms of insurance also. Yeah, maybe you saw in the previous video, but just something I want to add. So Andy, could you please tell in your own words what is a private health insurance basically?
Well, basically, there's two systems in Germany: the GKV and PKV. Yeah, so it's like the private health insurance and the statutory health insurance, or governmental, what we also call it. And the private one is actually a higher level of coverage. There is, unlike in India, in some companies, there's nothing left out. That is controlled by the government actually. That the coverage is a full coverage and more plus. So it's a better coverage, and it's for young, healthy guys. Mostly, if you enter it, if you're in your 30s, 40s, that's where the price is calculated. Even if you get sick, if you are older, then you don't have to pay more. You carry on the price from age 30, 40. It's actually most of the times cheaper. Because it's only calculated what we come later to your own age and everything.
Yes. So I'm coming to the questions. I think you
and
already
if you,
answered this.
You are eligible from a certain from a certain income on. If you are employed or self-employed, you are eligible for it no matter how much you earn. We come to that later. So
yes, thank you. So I mean, regarding the eligibility part, I think a few words like, what is current eligibility for someone to come to a private health insurance if they're employed? I think most of us here are employed people.
If you're employed, is an annual income of 66.6K. Yeah,
Okay.
so 66,600 or monthly 5,550. Yeah, so that's very easy to remember, 66 or 555.
In brutto. Yeah.
Brutto, yeah,
Yeah.
brutto, not net. Thank you for that. And it's rising every year. That threshold is rising every year, something like 1.5, 1.8, something like that. The last couple of years, pretty constantly. So assumingly it will rise to like 68 something next year.
Okay, that's nice. Good to know. So I think some you already answered, but just to repeat the question. So how is the price calculated? Like, does the age of the person, gender, and previous illness taken into account, and what or and what else is calculated on
Yeah,
this?
well, the age of the person is definitely an account. The gender of the person, no. Yeah, the gender of the person was before until 2012, I think it was allowed to differentiate. But since then, in the European Union, it has to be gender equality. So the price for female and male is the same, but the age, of course, differs. As younger as you are, as cheaper it is. And as I said, you don't have to pay every year more. That's very important. Like if you enter age 35, then you don't have to pay more with 36, 37, 38 automatically. Yeah.
Yeah.
So if everything, the whole calculation is staying the same, that means that we don't spend more than what all our premium income is. Yeah. Then it will stay constantly.
Okay.
Of course, you cannot avoid the whole topic with inflation or whatever. If everything is going to be more expensive and the doctors also have higher bills, and one day it will also be more expensive. But it doesn't have to do anything with age. The gender is the same, and previous illness is important. We ask health questions if you enter in the application. If you are below 50, you don't have to go and see a doctor. We just have 11 questions, which is actually pretty easy to pass. But if there's something severe illness before, severe history, then it would be getting more difficult to get in, or you would have to have a little extra premium. But for most of you, I guess it's not a problem.
Yeah. Okay. Thank you. You already answered about that it doesn't increase with the age. So next question or might come in the chat soon. Like, what about illness? Like, if we fall sick, does the price of private health insurance increases because of?
No, it's only at the time of entry. Yeah, if you
Okay.
are healthy now and once we sign the contract, once we approve your application, then you are in. And even if you get sick afterwards, that doesn't count. Yeah, that is actually what insurance is for.
Yeah.
We won't be able to throw you out. Yeah, we also don't have an interest to throw you out, of course, but that is also very important. Yeah, we don't have in German you say Kündigungsrecht. Yeah, we don't have that. And the law is protecting you there. Yeah, because the health insurance is mandatory. The only time we are allowed to do something is if you would lie to us with the health questions. And we find out afterwards you have for example, diabetes, and you don't tell us, then we would be able, of course, to say if we knew before, then we would not have taken you. But if you don't pay your premium for a long time, that's the only two situations where we are allowed to deny the coverage. Otherwise, once you are in healthy, you have the healthy price, even if you get sick afterwards.
Thank you. I think this is one of the major doubts or, false information that's circulating on Instagram and Facebook, for example, that somebody falls sick, then the price increases. So we have been talking in every session about this, but I just want to make sure that it's addressed again. Thank you for that.
Yeah.
So other big doubt, Andy, which people have is like private health insurance, does it have the same coverage as a public insurance? So is there any law protecting it? I think you mentioned in the initial introduction itself. And is there something that is missing that is covered in public by private, for example, and what is not covered in the private insurance, for example?
Well, actually, there's nothing right now in our plans. Couple of decades ago, when the private one was developing, there were things which were a little better in the governmental one. Yeah. But all these gaps have been closed by experience, let's say. So there's really nothing what I can say is really worse in the public one. Yeah. And as I said, the law protecting it is actually for the outpatient and inpatient treatment. You could leave out the dental one, but nobody's doing that. Yeah, the dental one is not mandatory, but all our plans and of most competitors include the dental one automatically, the dental coverage, and that is in all areas, inpatient, outpatient, dental. It's much better coverage. Free choice of doctors worldwide, even in India. We come to that point later, I guess.
Yeah.
Yeah, and then free choice of hospital, 2-bedroom, 1-bedroom, whatever you choose. So teeth up to 90%. Yeah.
Yeah, I think regarding the free choice of doctors, that could be a new info for people. So people usually have a GK file. I mean, government insurance, they have to go to the Hausarzt or the nearest clinicum. But like Andy mentioned, like you have a choice of looking for other doctors when you're in private. That's the meaning of free choice of hospitals. So next question, I think you again addressed this at the start regarding the price increase because of all this inflation and war and stuff. So we added this after someone requested in one of our previous sessions, Andy. So could you please tell, like, historically, how much has the price increase been in a public versus private, for example, and especially Arag?
Yeah, that is the funny thing. The governmental one is always criticizing the private one for you cannot pay it if you are in old age because they're increasing all the time.
Yeah.
Well, if you look at our history here, if you look at the two green lines, that's our products, Mid Best and Mid Extra. They've been on the market since September 2019. Since then, there was no increase. We also guarantee already until the end of 2024, no increase. In the comfort plan, which is in force already since 2006. Yeah, we just have here the last 10 years. And in those last 10 years, there was one increase. That was in January 2021. Yeah. And that was between 3 and 5%, between 3, the average of 3.5. But it was like, if you calculate it in euro, it was like 15, 20, 25, 30 euro maximum for each individual, depending on the age and depending on the deductible, which is also possible. So the governmental one was rising in the same time span in 10 years since 2010 until now for almost 400 euro, from 640 to almost 1,000 now, and next year we will definitely be 1,000 plus. We will be 1,050, 1,060, 1,070 probably.
That's true. I mean, I can confirm that because I came as a student in 2011. So I remember what was the price when I started my job in 13, and after almost 10 years.
We have proof of that. You can Google that.
Yeah, it's available online.
Premium, it's always rising because they are rising the income level. Yeah. They are not rising the percentage. The percentage has been pretty constant, but all of you guys earn very good money. Yeah, so most of you guys are above that 66K. So you are also above that Beitragsbemessungsgrenze. So that is rising every year, almost every year. There was only one time that they opted it out because of Corona, but then the next year they took 150% more from what they usually do. So that the average in public is now 979 euro, which is also not true, because 1st of July was the next rise, the next increase in the Pflegeversicherung. So the average one should be now 996, something like that. The rise was 17.50 euro. So we have almost reached the 1,000, and there's deficit in the governmental one of calculated 17 to 25 billion euro this year, and more than 30 billion euro next year. That is actually paid by tax money from the government to support the system. So it really doesn't work too well anymore, the governmental one. And that's why there needs to be a raise of at least 70 to 80 euro. That's what not the private insurances say about the governmental, but what the bosses of the governmental say themselves.
True.
Yeah. So it will be 1,070, 1,080 probably from January on. And then they're even discussing to rise the income level. That's what they're also discussing. So you really can just say, what are they really doing there?
I think you read my mind actually, because I have exactly the same questions on the last slide, a surprise question, but you
Yeah.
have answered them already. But I will show to everybody else like in which article it came about this
Well,
details.
that's just you read the press, I read the press. That's all.
Yeah,
Yeah. Yeah.
nice. Just one
Sorry,
question.
sorry to interrupt you. These
Yeah.
numbers are only the Arbeitnehmer part or both together? Arbeitnehmer plus Arbeitgeber part.
Yeah, the whole thing together is 1,000, of course.
No, no,
50
here.
50.
In the slide he's asking. Yes, it's Arbeitnehmer plus Arbeitgeber. It's the total price.
Okay,
Yeah.
sorry. Thanks.
Yeah,
Yeah,
yeah.
okay.
So I think someone asked this question also, like whether in private also employer will pay the half. So whatever they have been paying in public, they will also pay in private. So just answering simple question and sparing some time for Andy. Yeah.
Yeah, that's
Okay.
true.
All right. So we directly come to the numbers for those who are asking like what it is currently. I just created few examples. So here you can see with a very basic product, like currently in public, many of you saw the video yesterday regarding the Pflegeversicherung. It's almost now at 970 or 980. So for somebody who's born in like 1994, this is what the contribution will be, like 475 euros together, like employer plus employee. So maybe for those who are completely new, the information is health insurance is a contribution of health plus long-term care, this PV insurance. It's a compulsory insurance what everybody has to take. So when both of them put together, it's around 475 for someone who's around 30 years or 20 years age, for example. So, and also for a couple, I just put like same couple, same age with the child, how much it will cost. So kids usually come at a price of 152 euros, for example. And instead of what you might be paying like 1,900, like both working couple earning more than 66,000, you would be paying actually 1,100 together. So you would be saying almost 800 in brutto totally, I would say. Yeah, I mean,
I
we
have
will
a question, if
please.
you don't mind. My question is, for example, if the spouse is not working for some reason,
Yeah,
and if someone has two kids,
yeah,
what would be the difference of payment in public and private insurance?
sure.
Thank you.
So, Andy, would you like to answer that, or shall I? Or
I I
please.
only understood two kids.
Okay, I think what he meant was like, what if a couple where one person is working and then the other person is not working? In this case, how will it be in a private health insurance?
In that case, of course, you would have to pay for both adults and then for the
Yeah,
kids, and then we really have to see the single case. Yeah, we do that with a private consultation if it makes sense or not. Yeah,
yeah,
I mean from the coverage point of view, it still would make sense. Yeah, but of course, time is running positive for us. But if you are because if you are paying in the public one next year 1,080, and then maybe next year 1,180, something like that. And with us, you will still stay what you have here. What Aaron calculated is 1,100 with one kid.
yeah.
So with two kids, it would be 1,250.
Mhm.
Yeah. So the coverage is much better. So it maybe still makes sense because you all four people would have a better coverage. But of course, you have to insure each person. You have to pay for each person a premium with us.
Mhm.
In the public one, it's included. Yeah, but included in what? Included in 1,000 euro.
Yeah,
Yeah, so for a bad coverage.
that's true. So it's like more or like individual case we can see regarding the price comparison, but that is a possibility. Like if one person earning can also pay for all the thing, and still it can be same as public. Yeah. So
I have also question regarding this. Sorry.
yeah,
What if one couple is on public insurance, the other one is on private, and the public one, the couple loses his or her job, then
yeah. I
what options?
we have this point regarding job loss, so I don't want to, if you don't mind, I don't want to stop the flow of presentation. So I would request you to wait till the end so that when this point comes, please feel free to ask your questions. Yeah, is it okay?
Thanks. It's fine.
Okay, all good. Yeah, nice. So I'm sure everybody have a lot of questions in mind. We have separate time for that, so that's why we are trying to rush through all the slides. So usually in the private health insurance process, the major questions come like how it works with the claim, because in public you give a card and everything works. So Andy, could you please tell us like how it actually works with the private health insurance or ARAG, for example?
Well, in the private health insurance, you are pretty much under control. You are in the middle of the doctor and us. Yeah. So you have a contract with us and you have a contract with the doctor. So actually the doctor is going to bill you. Yeah. And then very often there is a fear, what if I get hospitalized? Do I have to prepay 20,000 euro? Then no, well, no, you don't have to.
Yeah.
That's the answer right away, because otherwise nobody would do it. Yeah, because not everybody has, I mean, a lot of you guys will have savings,
Yeah.
but not everybody is always having 20,000 euro just lying there, not invested in something where you can pull it out easily. So if there's bigger claims, you can always pass it on to us right away. So we pay the doctor or the hospital directly. It's also not defined how much, from 5 or 10,000. If 1,000 is too much for you, you can also pass that on to us. Bigger bills, I actually always suggest to send it to us, because so we can check if the doctor is not cheating on you before you pay it. Yeah. And usually if you get a bill from a doctor, it says you have 4 or 6 or 8 weeks time to pay. Even if it says it has to be paid directly, you still have 4 weeks. That's a governmental situation. But you can just do it with an app. We have an application. You just take a picture. You just some of the bills have already QR codes, or you upload a PDF, just like what you want, and then it's usually done within 2 or 3 days if there's no questions. My kids are also insured. And I'm privately insured somewhere else because I'm working 10 years for ARAG, and before I worked somewhere else, and then I cannot change. It's a little complicated because I'm sick already and overweight and old. Yeah, so for me it's better to stay in the other one, but my family is insured with ARAG, and right now I turn in bills from my kids. It takes 2 to 3 days. Okay. Yeah, and not because I'm an employee. We don't have privileges there. It's for everybody the same. Right now, we are really in the flow of 2 to 3 days, unless there's questions that the doctor really tried to cheat on you or something, and we have to ask the doctor, what did you bill here? Yeah, so we assist you. You are actually one unit with us. We are not against you, but the two of us are, responsible of paying the doctor and checking if the bill is correct. But you can do it with an app. You can actually also send it, of course, in paper to us, but that doesn't make sense in those times anymore.
All right. Thank you, Andy. I think this is like a basic doubt people have when they want to shift. So other questions like this price for the child, this 152 in comfort, which we showed earlier, like does this stay constant until they are at the age 18, or does it change in between? Could you please elaborate?
The price is for children is 0 to 15 until age 15, yes. And the price for the young, what is it called? Adolescents, Jugendliche, from 16 to 20, which is a little more. Like you pay 152, I think then you pay like 170 something. And then age 21 is the adult price, which there's a bigger rise. But usually the child is then studying or is in Ausbildung, and then it's actually governmentally insured anyways. So it's like that. It will always be below 200.
Understandable. Yeah. Okay. Thank you for that. So so now to the question of no claim bonus. So could you please elaborate what is this no claim bonus about, and how much can a person expect?
Yeah. So that is also one big difference to the public one. If you don't have any claims except of checkups and vaccinations, not talking about COVID, but that in general, the usual vaccination, what was there already for decades, which is suggested. And the checkups you can even turn in, but if you don't have any other things, what you turn in, what you have to claim, you are completely healthy, then you would get 2.5 monthly premiums, of the comfort or mid extra or mid best, plus depending on the product line, 600 or 900 euro. So under the line you will get back between 1.5 to 2.4 a year, and that one you don't have to give back half to your employer. It's actually unfair. It's completely legal. It's actually unfair for the employer because he pays half of the premium, and then you get it back, and you don't have to give him back half of the premium. Yeah, so that's quite a big amount if you think of what we showed before. If you pay only like 450 or 500 euro, and you get back 1,500, yeah, then that is worth 125 euro a month if you divide it. Yeah, so that's the big bonus what we have also.
Nice. I think this is a very good motivation. I think I have also a slide at the end, especially prepared to show what will be the effective Beitrag because of this no claim bonus when a person is healthy. So for the healthy years, you can definitely make use of it. I think you can also make use of the preventive health checkups and dental cleaning, right? In spite of getting the bonus.
Yeah. That's true.
Okay.
Andy mentioned about 1,524. I didn't really get that. 1/5 of the premium or 2/5 of the premium?
No, 1,500 to 2,400. That was just examples. Yeah, for an adult, of course. The children is always half of it. Yeah, because the children pay less. Yeah.
So, for example, if your MB, I mean, if your monthly contribution is 500 euros, for example, then you get back 1,250, just for a rough estimate, plus 600 or 900, depending on the product, like Andy said. So it comes to 1,800 or something like that. Yeah.
And well, the example from before, 450 euro times 2.5.
Yeah.
What you just said, 1,1 plus the 600, so 1,718, something like that to get back.
Yeah.
Thanks.
Okay. Nice. So I will go to the next thing. So yeah, I see your questions on the chat. So let me quickly go through this and then come quickly. So no claim bonus. Okay, okay, it's regarding that. Does no claim imply no visit to doctor at all? How about annual full body checkup, routine dental clearing? So would you
there's a list. There's a list. It's an extra PDF.
Yeah.
It's in the terms of conditions somewhere on page 100 something. So we created an extra PDF what you can print out and take to your doctor, give it to the doctor, and say this one is for free. Basically, what you can do. That is general checkups. That is preventive checkups, most especially in the direction of cancer. Yeah, it's not for all ages. Some of them start only age 35. Some of them start age 45. Some of them are every year. For example, for female, of course, the normal checkups female should go to every year is covered with no age limit. Yeah, then of course all the checkups for the children is covered, and that does not affect the no claim bonus. So we of course we want you to do the checkups and the preventive checkups, and you still will get the no claim bonus. But if there's any other coverages, you can turn everything in. It's your decision. Yeah, but if you have just a calf, and you go to the doctor, you maybe have a bill of 50, 60, 70 euro. You go into the medicine 20, 30 euros. So let's say it costs you 100. So it's your decision if you turn in the 100 or you don't turn in the 100 and you claim the 2,000 no claim bonus. Yeah. So it's more smart to pay the 100 first yourself and don't claim it. You can also claim it until 24 months later. Okay. So you don't have to worry. I missed a date. Yeah, everything out of 2023, you can claim until the end of 2025. Yeah, so you have lots of time.
I think that's a very good information. Thank you, Andy.
Yeah.
So so now let me go to the next question, which is popping in where we know. So shifting back to the public insurance for some reason. So can we shift back when we want out of free will during a job loss? And at what age I cannot shift back? So could you please elaborate on these things?
Okay, you can shift back if you own below the threshold. Yeah. So if you would go to Teilzeit or if you would go to another job where you earn less. I'm only talking about the employed person now.
Yes.
If you lose your job, the second one, you're automatically back in the public one. Yeah. And if you are age 55 or older, then it is getting more difficult to shift back. Yeah. So, but then it's a question again, why should you want to shift back? Yeah. Let's take my case. I changed with 27. I'm 51 now. So I'm insured privately for 24 years. I'm still paying less than 1,000 euro for it. Yeah. I'm still having the much better coverage for 24 years. In those 24 years, I got the no claim bonus 19 years. I only had to turn in 5 years something. So why should I go back to a system which has worse coverage and would cost me more? Yeah, and which is bankrupt actually. It's without the tax money, it would be bankrupt already. That's what you really have to say. Yeah.
That's true. Yeah. So what about job loss, Andy? So when somebody, I mean, this is happening because of some activities in USA, for example, now in IT sector. So what can they do?
As I said, usually you are automatically in the public one, but let's make an example. You will lose a job in June, but you know I have another one in September already. Yeah. Then you could also talk to the job center, and they would also maybe support the private one 50% in those 2 to 3 months. Yeah. Then you don't even have to cancel, but you could cancel. Yeah.
Okay.
So you are allowed to cancel. We of course we need proof. Then we will cancel the contract right away. No obligations for you.
Yeah.
But maybe it's smart to keep it. Yeah. Because then once you enter again, you don't need health questions again. You maybe are older. That's why it's more expensive. So that's why maybe it makes more sense if you have the other job. If you go abroad, if you go to your home country again, if you go to another country, I know there's customers who went to Denmark or to other European countries, and they came back from Denmark again to us. Stuff like that. Then once you leave Germany, we have the proof. Then you can also cancel the contract right away.
All right. Okay.
So for you, even if you are 55 or older, if you go back to India, we let you out, of course. Okay. So basically, if you don't have the German nationality, then you always get out, actually.
Okay, perfect. So another question is like, until what age can somebody shift back from private to public if a situation arises?
Well, as I said, if you stay in Germany, if you stay in the job, if you don't earn less, if you're not unemployed, then you cannot shift back after 55.
Okay, 55. Perfect. Okay, cool. So another question, Andy, like people have some like example which they want to explain. For example, in which cases it's disadvantages is another question. And also, if there is a couple where only one person is employed, in that case, does it still make sense? And what is the cons and pros of switching from public to private? Could you explain that scenario?
As I said, if only one person is working, of course, and the other one is like not working, then you have to pay for each person. Yeah, so it's really an individual calculation. Do you have kids? Don't you have kids? Do you want kids? How many kids do you want? Yeah, so if you pay for 2 adults and let's say 2 kids, or that was the example we had before, 1,200 maybe, 1,300. Of course, if you wish for 3 or 4 kids, then it doesn't. Will be the point where it doesn't make sense. Yeah. But for 2 adults, we have lots of customers who also 2 adults, 1 kid. It makes sense. Yeah. So, and the question is also if the spouse will never work again. Probably the spouse is not working when the children are young. Yeah. But then it's the same case with my wife. When our children were 5 and 7, my wife started working part-time again, and then she was insured in the public one. Yeah, and then she had additional coverage. There's also Zusatzversicherung, additional coverage. So there's lots of possibilities. Yeah.
Okay. I think, Rohit, if we want to check for you individually, we can check because it depends on the starting age of when you enter the price-wise comparison. But otherwise, we don't see a disadvantage in general. Yeah. I hope that answers your question. So other question which might have this no claim bonus, is it taxed, Andy, also? Or do we get it?
Well, it's like, of course, you can only deduct from the tax what you pay with us. Yeah. So let's say if you pay €500 a month, that's 6,000, and you get a no claim bonus of 2,000, then it will be deducted, of course. And you can only claim 4,000 for the tax and not 6,000. Yeah. So indirectly, it means yes, it's lowering the no claim bonus is lowering your tax, or you have to pay more tax because of that. Yes.
Okay, but will that amount what they get will be already pre-taxed when they receive it, or do they get it without any pre-tax?
You will get it. So you will get it from us completely. Yeah. We won't take the tax. It's your responsibility to put the right amount in the tax declaration.
Perfect. Nice. So thank you for that. So next with the dental, I think there's a questions on maternity leave and pregnancy. We'll come to the next topic on that. But before that, regarding the dental coverage, So, does it cover everything? Like, what is not covered? What's the advantage in private in dental coverage?
Yeah, well, most especially the dental coverage is a much higher level in the private one than in the governmental one. In the governmental one, for example, for an implant, you only get like 300-400 euro, and it costs 3,000 up to 3,000, even up to 3,500, depending on the doctor. With us, depending on the plan, Comfort, Med Extra, Med Best, you get 100% for the dental treatment always, and you get 80 or 90% for the dental prosthetics. But in the Comfort is only 4 implants for each 8 implants up and down, for the teeth. It's limited, but in the Med Extra and Med Best is not limited, and you would really get 80 or 90% of also the implant, for example. And if 90% of 3,000 euro is 2,700 for one tooth, and you have 28 teeth in your mouth except for the wisdom teeth. So that is a much better coverage.
Okay.
So you only have to the first 3 or 5 years. There's a limit. It's called like Zahn budget. So the first 3 years, it's 1,000, 2,000, 3,000 maximum. You just want to avoid that people have already pain and don't go to the doctor. And then once they're privately insured, they go to the doctor and
try to sort it out.
We have to pay 10,000 euro right away. That would be a little unfair to everybody who is honest.
That's correct. So it's like more likely that as you are in the system, when people get regular checkups, then the coverage increases like from 1,000 to 1,000, and it steps up after 5
If you
years.
have an accident, for example, if you would trip and fall on a chair or something, there is no limit from the very beginning. It's only the normal, let's say the normal abuse of the teeth.
Okay.
And only in the first 3 or 5 years, depending. In Comfort plan is 5 years, in Med Extra and Med Best is only 3 years.
Okay. So can somebody switch between these plans, like Comfort, Med Extra, and Med Best, for example?
Yes, if you answer health questions, going up is always possible if you're healthy, or you take an extra one, which is called Flexi Pro. It's called costs only €5. Then you can change for the first 10 years. And you're going down, you can change all the time.
Okay, perfect. So I think this is important for people to know. They
There's
can
also
start
full
with something.
Flexibility. Full flexibility in all directions.
Perfect. So now to the important question of maternity. I think 2 people already asked about this. So first I'll talk about the costs. So does private health insurance pay for all the expenses occurring in during a maternity period?
Yes, it does. It doesn't only pay all the costs, it pays much more than the governmental one. For example, as I said, I have 2 children. What I didn't say actually, I only said I'm an international family. I have 2 children. They are aged 16 and 17 years old now. And when my wife was pregnant, she also had a little problem with she had a little pregnancy diabetes, which we didn't know in the beginning. And the usual checkup is in the public one is during the whole maternity is 3 times. There's three trimesters, and then you have the right for 3 checkups. And in the private one, we went every month. The doctor suggested to come every 4 weeks. The private one paid it without any question. So it's a much better coverage. The newborn is also covered if you are insured with us for more than 3 months, which should be the case. So if you are in the 7th month pregnant already, it doesn't make sense to switch now. Then you should get the child first in the public insurance, and then you could change. But if you're not pregnant now, the 3 months doesn't matter because pregnancy is 9 months. So the child has no health check. The child will have the same coverage than the parents without health check. And yes, you can plan the childbirth in India because we have a worldwide coverage. We have a coverage in Europe for 365 days a year. And we have a coverage worldwide of 3 months a year. So of course you would have to do the right timing when to take the airplane to India, because I think the airline rules are they only take you if you are in the 7th up to the 7th month. So you would have to go in the 6 months or something like that. But you can also extend those 3 months against extra premium. Yeah, if you wanted the more relaxed version, then you can also go before. Yeah.
Okay.
So, yeah, but it's possible. We just, of course, need the bills then translated into English if it's not in English, anyways. That's the only regulation. Yeah.
Okay. Yeah, I just want to add, like in general, when you are in India and the bills are in not in a language understandable like English or German, then you have to translate it to expense. Someone had this experience, but otherwise the claiming was totally the same way as uploading an app. Yeah. So the next question is not connected to this directly with the cost, but for example, how is the during the time the health insurance contribution is handled, for example? Like are they exempted from paying, or how many months they pay? For example, people like women who take breaks.
If you're insured with us already, as I said, more than the 3 months, then you have this Elterngeld. If you get the Elterngeld, Elternzeit, then you don't have to pay the premium for 6 months for yourself. And for 6 months for each person which is insured for us, of course.
Okay. Perfect.
You don't have to pay the full amount. The employer is not supporting you during that time. So we said we do the 6 month full premium. It's better than 12-month half premium. It's better for the people who don't take 12 months, but who, let's say, the wife takes 7 months and the father takes 7 months. You can do maximum of 14 months. So it's better if each one of you has 6 months. You don't have to pay anything.
Okay. All right. Another question out of maternity, I think we covered the topic with the most generic questions. So does gym or fitness studio, for example, is a part of health insurance? Is it covered, or someone who's having a healthy lifestyle, do they have any extra bonus in a private insurance? Is the question.
Well, in the mid-best, there is a possibility to get an extra €200 a year, not a month, for some preventive things, but it's not each fitness studio around the corner. It has to be a proven one, which is really proven quality for example, for helping your back pain or whatever. There is a list of that, but we should go into detail with that in the private talks.
Okay. Perfect.
Besides that, it's the same price for everybody. We are not telling you are not allowed to smoke, or if you're overweight, then you have a little extra premium because of that already, but we don't ask if you smoke, for example.
Okay, all good. So I think we're almost to the end, Andy. So one point I missed, someone actually asked in the question, what about eye treatment? I think this is a key selling point also for the private. So laser operations, is it covered in private health insurance, and also the glasses? Could you please tell about that?
The glasses is covered in all plans, but it's limited depending on comfort. Mid extra, mid best is like 150, 300, €600 every 2 years, or if your eyesight changes more than 0.5. The laser is also covered in the mid extra and the mid best, 2,000 or 4,000 euro. But then you cannot claim glasses for 5 years. But actually, if the laser is done right, you shouldn't need glasses at all anymore.
Definitely, that's a good point. All right, thank you, Andy. I think that will answer this.
And
query.
there's also no waiting time for that. If somebody is seriously thinking about lasering the eyes, there's no waiting time for that. We had customers who started really with the coverage in September, and they did it in October already and got the 4,000 euro.
Oh, that's great. That's great. So someone asked like about the no claim. Do they have to claim it every year? I think it's automatic. So could you also confirm that once, please?
Yes. If you don't turn in bills, then you will get that. You will get that always the next year, the following year in September only. Yeah, of course, we wait for like half a year if people still claim something. You have the right to claim it 2 years after, but if you would claim it after that and you get the bonus already, then of course it would be calculated against each other. Okay. Yeah, but we have this waiting period. But once you're in that rhythm, once you are insured more than 1 year, September is always a happy month because you get a lot of money end of September. It's like a second Christmas.
Yeah, that's very true. Second Urlaubsgeld, I would say it. Yeah, actually.
Yeah.
That's nice. So Andy, before going to that, I'll just try to put some questions from the chat which we can answer quickly. So other question is, what about the retirement age? Like there's a myth or saying like it gets costlier always when people age. So is it true? And for example, I would like to always take this case. For example, somebody who's earning 3,000 netto now, and they have the same 3,000 netto right now after retirement also. So in that case, public and private comparatively, how it will be? Could you please explain?
Well, in the public one, of course, you only have to pay that half of what you're also paying now. I mean, you don't have an employer anymore, yeah. But you only pay your share. You only pay the 50%, yeah, of whatever that will be then, yeah. So you cannot take the netto, not the net income, but you have to take the brutto, the gross income. Yeah?
Okay.
So I would assume that the person would also pay up to the highest one. Yeah.
Okay.
And then if that is rising every year, then that could be more than in the private one. Yeah.
Okay.
In the private one, it could be more if you enter the private one, if you are already 50 or 55, if you enter the private one too late. Because in the private one, actually, if we take like 500-600 euro, 1/3 of it, about 1/3 in our calculation, we don't need now for the young person. So if you pay 600 euro, we save 200 euro. Yeah. For the customer, our mutu, yeah, we save that, and it's only for you, not for all the people who are insured. And then it has a function that the premium is staying constant in the old age. Yeah. So the problem is if people before 2009 changed from private to another private, they always lost this old age fund. Since 2009, you can transfer it. The government secured that already.
Nice.
So there's not that problem for you in the future. Yeah, you can transfer like 80% plus minus of it. And if you start age 30, 35, 40, you are fine. Yeah, because we are really putting 30-35% back for the old age.
Okay.
Yeah. If it's not enough for you, you even can voluntarily save more. There's another component which you can add. It's called Beitragsentlastung, BEK. Yeah. You can also do more, even with a tax advantage. Yeah, even the employer has to support it. But that is all something for the private consultation, I would say.
All right. Okay. I think that's a very elaborately explained question.
And what you show here, the public one is already discussing the deductible, which is unbelievable.
This is what I want to highlight. This is actually from a news article. I can share the link later. So they are actually planning to add self-contribution value in public insurance system, which is crazy. And anyway, they have already announced, like you can Google Lauterbach health insurance plans. So he's already increased the price of the Pflegeversicherung, like long-term care, what we paying from this month. And in future and in next year, they're also planning to increase the health insurance also. Like Andy spoke about it. I just want to put some articles, but he already told about it.
Let me say one more thing.
Please. Yeah.
The problem is, I mean, this is an international chat. Yeah, of course.
Yeah.
I'm in an international marriage. My family is international. So that's why I'm speaking this out. That not anybody is getting it wrong. I'm not a racist at all. I'm the opposite of a racist, because we are all foreigners almost everywhere. Except in your own country, we are all foreigners. If Russia or whoever would bomb Germany, then maybe I would be one of the first guys who would also be a Flüchtling and run to France or Belgium or wherever, to be safe. Of course, that's just a human right. But the problem is what our government did with all the people coming from Ukraine. It's good that we help them. From a humanitarian point of view, it's good that we help them. But everybody's coming in from Ukraine even without working. They are completely in the public social systems right away. So we have more than 1 million people who came from Ukraine, who are already insured in the public one, who didn't pay a single cent. Yeah.
Mm-hmm. Mm-hmm.
Even if a lot of them will be integrated in the job market, which will take years because German bureaucracy is too stupid. Sorry to say, but it's the truth. Yeah,
I'm sure many will accept that.
I don't want to be too political about it.
Yeah.
But I just saw a report on TV a couple of weeks ago that in Germany, until now, 10% of all people who came from Ukraine are in the job market, even
Mm-hmm.
though much more want to work.
Mm-hmm.
Yeah, and I think in the Netherlands it was like 70 or 80% already.
Oh, wait.
Yeah, so then you can say, how stupid are we really? Yeah,
Mm-hmm.
they're just talking too much regulations. I mean, there's people who are qualified, doctors.
Mm-hmm.
We are in lack of doctors. They don't let them work. So it's really stupid. Yeah.
Yeah.
And they really have not only to talk about it. Yeah, it's the same thing with getting people from abroad, more from India or whatever.
Yeah.
They don't always have to talk about it. But they have to do something. And if they do something, of course, then it will be better.
Mm-hmm.
But right now, there's 1.3, 1.4 million people which don't pay a premium.
Mm-hmm.
And that's also why the public is having this problem. And that's why they are discussing even deductible, which is crazy.
Yeah.
Do you want to pay 1,000 euro plus? And then you still have to pay the first 800 euro yourself. Yeah, it's
really
crazy.
It's going crazy currently. I mean, I just want to highlight these points. This is the first time we post about this. So, I think, thanks, Andy, for that. So I'll just show about this example, like how people do it otherwise, but just I'll address a few questions in chat, a lot of questions. I'll try to couple questions. So first question is like, does private health insurance treat, for example, cancer or terminal illness in general?
Yes.
Okay.
It does.
Okay. And is there any coverages for permanent disability in health insurance?
For what, please?
Permanent disability, also Berufsunfähigkeit.
Well, no, that is actually you have this long-term care, or if first you get sick for a longer time, which means krankgeschrieben, Arbeitsunfähigkeit, and there you need the Krankentagegeld.
Yeah.
And then once it is permanent, you need the Berufsunfähigkeit. But we also can talk about that. We also have a very good private solution for that.
Yeah, definitely. Yeah. I think the other question is doesn't apply. Like, are there any death claims that's with life insurance, possibly with health insurance not connected? So another question we have, Andy, is like, okay, if a couple is working and one of them loses job, and for 3-4 months, so can that person still remain in PKV, or will they be by default put into public?
No, as I said, you can always stay in the private one as long as you pay it.
Yeah.
And there is already cases where really the job center supported it also for those 3 to 4 to 5 months, whatever. Because the job center also has to pay something to the public one.
Mm-hmm.
Yeah. So if they pay something to the public or they pay some half of it to the private one, it's not that big a difference. Sometimes it's even less for them. So you just have to talk to them. You don't actually have a Rechtsanspruch. You don't have a legal right. But in a lot of cases, they are doing it. Yeah.
Okay. So can they go to something like this Basisvertrag? So maybe a few words on that for completely newcomers.
What is that again?
Basisvertrag, like the basic contract or something. When people lose job, they can have.
There's also this Basisversicherung,
Basisversicherung.
Basisversicherung, Standardversicherung.
Yeah.
If you don't have money, if you really wouldn't have money, then you are still insured in the private system, which is having the same coverage as the public one. And the premium would be not more than in the public one also. Yeah.
Okay.
So there's really actually no danger that you will not be insured, or even if you won't be able to pay for it. Yeah.
I understand. Yeah. Thanks, Andy. I think I will come to the for the question. So this is one example I created, Andy. I think this is also new for you. So people were like sending me screenshots from other providers, like they're just saying like it's 100 euros per month. I was a little shocked. Then I calculated the same thing for Comfort Med Extra for a customer who's 27 years old. So how they do it is like they take, I mean, it in like effective Beitrag, like effective monthly rate. They take the bonus, subtract it, and divide it by 12, and then tell like it is what they actually will pay. So we can also do such a calculation in personal calls with each of you. So that's what I want to show this.
Yeah, we can do that. I'm just telling you why we are not doing the marketing for it, because we are conservative about it.
Yeah.
We don't want you just to change because it's less than 100. Yeah. And then you get sick and you don't get the no claim bonus.
Yeah.
And then you tell us, why didn't you tell me?
Yeah.
Yeah. So that's why it's we say it's not really serious to go into the marketing with this.
Yeah.
But if you are healthy, and I wish you all to stay healthy, then it is like in this Excel, and then it's also below 100. Also with us. Yeah.
Yeah. I mean, we have not done it yet. This was the first time I did for somebody, but since there is a wrong picture for completely newcomers, like people just see the numbers and think it's less than 100 euros, what they pay from hand. That's why I want to also show this how it is. Yeah.
Actually, in 2011, there was these commercials from some broker. Yeah. And they had this campaign nationwide, even on TV, when there was the news, and it said private health insurance for below 100 euro. Yeah, and then just shortly after that, by chance, it wasn't connected. One private health insurance, and that was the only incident in Germany ever since.
Yeah,
almost got bankrupt.
Okay.
Why? Because they signed the let's say cheap contracts.
Yeah.
The people who didn't pay that much premium, they didn't do the health checks really well. And so all the private health insurances together said, we have to get rid of this image. Yeah, the image of the private is not cheaper. The image of the private is better coverage.
Okay.
And that's what should be emphasized. But if you are healthy, it's still true. It is less than 100 euro if you draw a line.
Perfect. Yeah, that's perfectly said. So for somebody who wanted to take this insurance or talk more in detail, so I think Ashish joined late. We are from a company called Arak. Like Andy's from a company called Arak, basically, and Livingston as himself. So the products what he spoke is from Arak. The details I will share later for everybody who registered over email about the product line, the brochure, as well as certain details which we are not able to talk here. And those who want to take or want a consultation, you can directly book an appointment first, and then we can connect to Andy. So because we are on 7 o'clock, I just want to give those people who wanted to first have an idea complete. So we are on time. So thanks for that, everybody. So I see a lot of questions now on screen. We will try to address the important ones. The others, we will put it over email because it's really lengthy. So there is a list of questions I see from somebody. So it cannot be answered in next 5 to 10 minutes of time. So I don't want to hold Andy also longer here. Hope it is fine. So Andy, like maybe a couple of questions. Is it fine, Andy? So do you have?
Of course.
Okay. Thank you. So I think this would. I'll just take the most important ones. First thing is, if somebody is switching jobs within EU and they are a German citizen, can they still use the same insurance?
Yes, they can, but they don't have to. So it's full flexibility. They can. It's valid in all of EU.
Okay.
But then in other countries, sometimes they have their own system where they don't accept it. But if they accept it, you can stay with us, of course.
Okay.
And if you would go to another country, let's say we had that case already, somebody going to Denmark for 1 or 2 years and then coming back from Denmark, or one spouse going to Denmark or to Austria and then coming back, then you can also put it on hold.
Okay.
Putting it on hold means you pay like 5%. Yeah, there's two different versions actually, 5% or 30%. I will let you know privately if you're interested, but there's options to be flexible, to keep hold on to it. Yeah.
Perfect. So other questions like we spoke about maternity or pregnancy handled in India. Is it applicable for other treatments and surgeries also? If the person wants to do it.
Yes, it is. It has to be, of course, medically necessary treatment. That's always in the terms and conditions. Yeah, medizinisch notwendige Heilbehandlung, medically necessary treatment, and the price level should be not over the German level. Yeah, but even if it's a specialist for some cancer in the brain, whatever, and that's not in India, but in the United States.
Yeah.
And they don't care about the German laws about how much it costs in Germany, even if it costs much more. And this one is not available, this treatment in Germany or in India or anywhere.
Yeah.
And it makes sense, it's medically necessary to survive, then we will also pay for that one.
Okay. That's great to know. So other important questions
most other private companies are not doing that.
Yeah,
it's called planned treatment abroad. Geplante Auslandsbehandlung. Yeah.
Okay.
If you are going on a vacation in India and you are stepping into something and your foot is cut and you have to go into emergency room, that is covered with all insurances. Yeah.
Okay.
But if you have something, you have a severe sickness and you say, I'd rather let it be done in India because I have my family around me, I have my language, yeah, so I trust, I want to be there. That a few insurances are only doing that. This Geplante, we are doing it.
Yeah. Okay, perfect. I think that would add up. So Andy, like apart from this question, like how was the performance of the product in general from Arag in last years, and was there any kind of recognition or scaling which you can give, set an example or tell us about? Because we didn't talk about Arag, we spoke about everything in general. Now people want to know like the company.
In most comparisons in the last, since the mid extra mid best is there, we are top 1, top 2, top 3 in the market from the price level and the coverage level and the combination of it. And yeah, from the last 4 years, from each contract what has been signed in Germany, every sixth, you also don't know that, we haven't talked about that, 16% of all contracts from the last 4 years have been done with ARC from all private health insurances. So that is really, unbelievable, brilliant.
Perfect. Yeah, thank you. I think that adds up to the top of the cherry in the cake. So
before we were 1%, okay? 1% of the market share, and we have 16% of the last 4 years sales share.
All right, nice. So I think I'll wind up with one question, Andy. Like this is maybe useful for a working couple. So in which case, for example, when two people are working, one is in GKV, other is in PKV, in which case the child should be in PKV, in which case the child can be in GKV. Like GKV is government, PKV is private, for those who are hearing it.
If both parents are above the threshold, then you have the free choice.
Yeah.
Even if one parent would take the private and the other parent stays in the public one, maybe because due to health reasons, and it doesn't matter, the child can be there or there, you can decide. If one person is above the threshold and the other one is below the threshold, then the child has to go above the threshold. Yeah.
Okay.
And the child has to go with the one who goes private. Yeah.
Okay. Perfect. Thank you. I think we have answered most of the questions. Abhishek, I think we spoke about the job loss already. I don't know if you have missed it, but I will share the recording with you. You might be able to have a look at it. And regarding the pension, also we spoke initially. So if there is an example which you want to discuss, we will write an email back with that. So
and I just saw Baden-Württemberg. We also do Baden-Württemberg. We do all of Germany.
Yeah, I thought. I mean, it's completely Germany. We can do all over. Yeah, so it's all online.
We are doing this online via Teams, via Zoom, whatever.
Yeah,
no problem. Yeah.
All right. Perfect. Thank you, Andy. Thank you. Thank you, everyone, for. Yeah, please. Sorry.
I said you're welcome.
Okay. All right. I mean, little audibly out. So really, thanks everybody for making this time to come out and have the session. And also, Andy, thank you again for making time out of your very busy schedule. He's one of the top salesmen. So I mean, top person, experts in this field. So it's a very honor to have you as a guest here, guest speaker. So if any other questions, guys, I will definitely write in chat for you or in emails back. So please feel free to put all the queries. So other than that, I think we are done for the day. So once again, thank you. If you're interested, I will send you links where you can book appointments directly with us. So you can book, or some of you are already in our groups. You can directly write me if you want to enroll. And any other further queries, just feel free to write back. Yeah. And of course, leave a star rating on the Google review. That also you'll get a link in some time. I hope it was helpful.